Hi there. Oh dear. Hi. My apologies for being late. Hope you haven't been waiting long. You haven't? Oh, that's good. Again, my apologies. We have been absolutely swamped today. A lot of patients. But anyway, how do you do? My name's Mike, and I'm going to be performing your cranial nerve examination today. Just having a quick glance at your file. There's a letter of referral from your doctor saying that you're here today because you might have a possible concussion, as that's what the letter says. Your doctor isn't sure. Okay, that's no problem at all. There's a note here saying you suffered a fall recently. Yes, okay, and you've been complaining of a slight numbness in your right side, is it? In your right side, okay. Is that the entire right side of your face, or just your forehead? Just here, okay, perfect. We will make a note of that, and we'll get back to it. To begin with, could I start with your name, please? And your address. Perfect. Your date of birth. And that would make you how old? Okay, perfect. Is there any other medical history that I should be aware of before we begin this examination? No. Any prescribed medication that you are currently taking or have taken in the past 6 months? No, okay. Do you smoke? Drink? Okay, perfect. Okay, just to put your mind at ease, today we'll be performing a cranial nerve examination, and what that is we are going to be testing the nerves that exist within your head, and they include the senses of touch, smell, and sight, and we'll be doing a few various tests to check out all of them. I will be getting close to you on occasion, and I will be touching your face on occasion as well, if that's okay with you. Okay, perfect. After the examination is done, I will do a full write-up, and I will forward that on to your GP. I won't give you any diagnosis right here, but if you make an appointment with your GP in the next week or so to get in, you should be able to get them then, okay? Perfect. Okay, and before we get started, I'm just going to have a look around just to check out your face and your head all together, just to see if there's any facial structure abnormalities that I should be aware of. Okay, perfect. I'm just going to have a look around. Okay. Are there any bumps or bruises that I should be aware of before we begin? You have a bump on the back of your head. And where would that be? Is it further down the neck, or? Okay, it's around here. Okay, is that recent, or? It's from birth. Okay, that's no problem at all. Thank you. Nothing else that should be. That is worth noting. Okay, that's no problem at all. Thank you. Okay. Birth. Have you ever gotten that checked out, or? No, it just was one of those things that you've always had. Okay, that's no problem. Okay. Now, to begin with, the first cranial nerve we're going to be examining is your sense of smell, the olfactory nerve. Now, how this is going to work is I'm going to have you close your eyes. I'm going to have you block one nostril, and I'm going to be presenting a little tube with a familiar scent to you. And what I'm going to ask you to do is take a nice sniff of it and just tell me what it is, okay? Perfect. Now, if you wouldn't mind closing your eyes, and if you could block your right nostril for me, please. Perfect, thank you. Okay. Now, you could tell me, take a nice sniff of that. You could tell me what that is, please. That is mint. Correct. Okay. If you could now please close your left nostril and take a sniff of that for me, please. That's it. That's perfect. And what is that smell? Correct, that is cinnamon. And finally, you can leave both nostrils open this time. Eyes closed though. And finally, what is that smell? Perfect, that is tea tree. Perfect. That is 3 for 3. Olfactory nerve seems to be in working order. And before we go on, there hasn't been a change in your sense of smell, has there? No. Okay. Just making sure. Usually we ask that before we do the examination. Okay. The second nerve we're going to be testing out is the optic nerve. Now this is primarily to do with your vision. So, if I'm just going to hold up this chart, and if you wouldn't mind please reading down the 5th line down for me, please. That's perfect. Can you read any lower? Could you perhaps get this line here below the green line for me? Perfect. How about the 3rd from the bottom? That's too small, that's okay. How about the one that's just above? Try your best. Okay, perfect, perfect. Do you wear glasses all the time? You do. And when was the last time you were at an optician? The last 3 months. Okay, that's perfect. So your eyesight is... What's that? Oh, don't worry, I know the feeling. Sometimes my eyesight can be quite, for lack of a better word, lacking. Okay. Moving on. Next, I'm going to be testing your pupil dilation. So if I could have you cover up your left eye for me, please. That's perfect. Now, I'm just going to be getting up a bit closer to you, if that's okay. So if you can just keep your left eye covered. I'm going to be shining this light into your eye, just like that, just to test your pupil dilation. And then we'll go and do it on the other side. Perfect. So just keep your left eye covered. That's it. Perfect. Okay, perfect. If you could cover up your right eye for me now, please. We'll do the same. Okay, perfect. You can now uncover your right eye. Okay, I'm just going to have you look up and down and just have a look inside your eye, if that's okay. Okay, we'll start with your left eye. Okay, if you could look up for me. Okay, look down. Okay, look to your left. To your right. That's perfect. Do the same on your other side. Could you look up for me? That's perfect. Look down. Look to your left. and look to your right. Okay, perfect. That wasn't uncomfortable for you at all, was it? No? Okay, perfect. Moving on, I'm going to, again with the light itself, try to keep your head as still as possible for me, please. And what I want you to do is follow the light with your eyes only, without moving your head, please. Thank you. Okay, here we go. That's perfect. Perfect. No problems there. There's no pain there when you're moving your eyes, no? Perfect. Okay. Now, if I could have you stare directly at my nose, please. What I'm going to do is, I'm going to be placing my fingers just at the edge of your peripheral vision, and if you could tell me at what time when you can see my fingers wiggling, okay? Perfect. Just tell me which side is wiggling. Perfect. Now, continue staring at my nose and just tell me when you can see my fingers come into your field of vision. Good. Okay, perfect. And we have done that. Okay. Moving quite swiftly throughout this, you'll be happy to know. Okay. Next, we're going to be testing just the feeling in your face, if that's okay. This will require me getting a bit close and just touching your face. That's okay with you? Perfect, thank you. Okay. Now, this test involves a cotton swab and just the pointed edge of a paperclip. If you just lay your hand out, I'll show you. It's not sharp, but it's got a point to it. Yes. Okay. Now, what I'm going to ask you to do is to close your eyes, and I'm going to be touching your face with either the swab or the paperclip. If you could tell me where you feel the sensation and what it is, that would be perfect. Perfect. Okay. Just close your eyes. Okay. It's perfect. You not feel that? No. Okay, that's the side of your forehead that you say there's a numbness in. We'll keep note of that. And forehead. Okay, we'll just carry on. Cheek width. Swab. Okay, perfect. Paperclip, that's it. Chin swab. Paperclip on your cheek. Nose with the swab. And your cheek again. Perfect. Okay. You can open your eyes now. Okay. So, don't worry, there's nothing to worry about there. Just have to make a note that it's your left side of the forehead rather than the right. Okay, if you don't mind now, I'm going to be getting in with my hands and just feeling your face, if that's okay. Just be putting on gloves first, however, don't you worry. And what I'm going to be doing is I'm going to be feeling on both sides of your face in the same place. And I want you to tell me if you can feel the same on both sides. That's okay? Perfect. Okay. So your cheeks. Same on both sides? Yep. Okay, perfect. Your temple. Same on both sides? Yep. Your forehead. Nothing on your left side, okay. You can feel that okay on your right, okay. Just top of your head. Same on both sides? Perfect. And then your chin. Same on both sides? Nose? Same on both sides, okay, perfect, thank you. Okay, perfect. If I could just have you now open your jaw for me, just wide. And what I want you to do is I'm going to put pressure on the bottom to close it. What I want you to do is to resist that. So, for example, okay? Perfect. Sit, fight, fight, fight. Perfect. Perfect. Okay, we'll test the movement on your face next. So if I can get you to raise your eyebrows for me, nice and wide. Perfect. Okay. You see there, you're able to raise your eyebrows. No problem. Okay. Okay, could I get you to smile for me, please? Nice big smile. Feels okay? Yep. Okay, could I have you clench your jaw for me? Over your teeth. That's okay. Could I have you blow out your cheeks for me, please? Like a purple fish. And when you say it like that, I'm just going to put pressure. Don't let me empty the air. Perfect. Could I have you frown for me? Crease your eyebrows. Okay, that's perfect. Okay, now what I'm going to do is just test your muscle building in your shoulders. So what I want you to do is shrug your shoulders like that. I'm going to attempt to push them down. Again, I want you to resist, okay? Perfect. Just shrug for me. Perfect. And that felt okay, yeah. There was no pain when I was putting pressure on. No. Okay, perfect. Just get rid of these. Okay, just some final test. Could you look all the way to your right, please? So, like that. Perfect. All the way to your left, like that. Move your head forward and back. Was that comfortable? There was no pressure at all? No? Okay, perfect. Okay, could I have you stick your tongue out for me, please? Wiggle it to side to side. Okay, so inside your mouth, could I have you put pressure on either side of your cheek with your tongue, please? Perfect. Perfect. Again, no pain, no pressure. Okay. That's awesome. we've come to the final portion of the examination now, and that is going to be testing your hearing. So what I'm going to do is I'm going to have you close your eyes again, and I'm going to place my hands on either side of your ear. I'm going to do this for about 5 times, and I want you to tell me what side the sound is coming from. Okay? Perfect. Okay, so have you close your eyes, please? Thank you. Perfect. That's correct. Perfect. You could hear both of them. No problem. Perfect. And finally, I'm going to come up close to either side of your ear, so if that's okay with you, okay? I'm going to whisper 3 numbers. I want you to listen carefully and repeat those back to me, if that's okay. Perfect. 7, 42, 5. Could you repeat those back to me, please? 7, 42, 5. That's perfect. I'm going to do the same on your other side. 109, 78, 21. And if you could repeat those back to me, please. 8 and 21. That is correct. Okay, that concludes your cranial nerve examination. From where I stand, everything is above board. Besides the slight numbness in the left side of your forehead, you seem okay. You're in good spirits, and there's nothing out of the ordinary. Just from my point of view, the numbness that's associated in your left side is probably a side effect of the fall that you encountered, and is nothing serious or malicious at all. You should probably start regaining some feeling in the next few weeks, and if not, I would definitely advise going back to your GP to get it looked at further, just as a precaution. But from where I stand, it definitely hasn't hindered you in any sense. Again, I haven't done any write-up yet, but from what I've seen, you seem okay. There's nothing to be worried about, basically, is what I'm trying to say. But like I said, I will be forwarding on my write-up to your GP in the next week or so, and they should give you a call. And if they don't, make sure that you give them a call, because it is very important that you know what is going on, as you're probably aware. Actually, you know what I'll do? I will... One moment. Here we are. What I'll do is this is a letter. What's your doctor's name? This is just a letter that I might sometimes give patients to give in to the receptionist of their doctor, so their doctor is aware that you have come and gotten the test done. so they can put you on a priority, or perhaps you can go in when you're booking your appointment and it will be fresh in their minds. The date today is 12. Okay. That is for you. Oh, it was no problem at all. I'm glad to be of help. It is, after all, it is my job. Well, thank you. I really do appreciate it. And thank you. I know sometimes it can be a bit uncomfortable for patients to come in to a complete stranger and have them all up in their face, but you handled it very well, I must say. No problem at all. Perfect. Alright, well, thank you for coming. I hope you feel better. I can assure you that everything is okay with on my end anyway. Okay, perfect. Yes, hopefully if I do see you again, it'll be with good news rather than the bad. I hope so too. Alright then. Take care. The receptionist will see you out, and I hope life treats you well. Okay, bye now.